Mike Galbraith here. I'm a family and sports medicine physician, and I'm trying to work on my posture today.
You're doing a good job.
Thank you very much, as are you.
Brian Boehme, physiotherapist here at Elite Sports Medicine. I'm really excited to be here.
Yes, and I'm excited for you to cure my wrist today, because I have some chronic wrist issues and some stiffness popping, and I hear you're the voodoo master.
Well, I've been called lots of things, but I'll take what I can get.
There we go.
But we'll start with this. We talked just the last video about the elbow. I constantly will see elbow and wrist issues going hand in hand. If you think about it, this bone right here is the same as this bone right here. So they're very much connected.
Yep.
As well as all of these muscles that have tendons that cross the wrist and the hand. So I often will at least check those areas to make sure that they're not becoming part of the problem, or at least adding to the problem.
Sure.
So what I was going to show you is I can show you a simple thing. I'm going to have you scoot that way on the table just a bit, just like that. Good. So I'm going to show you how I would do this on a patient, but then I'll also teach you how I'd have you do it on your own.
Which one do you want?
So I'll just come to this one right here. So really common thing to do would be to look at right at the base of the thumb here and get some of these bones in your wrist to fold. So all I'm doing is using my thumbs on this side to help get some leverage to get this side to fold. Because every time I go with this, basically put the wrist in this position, I expect to see this side over here lengthen and this side over here fold. If that's not happening, all I'm doing is helping. So I come like this to go into basically to wrist flexion.
Yeah.
If I come here to wrist extension, do the exact same thing, but using my thumbs now as leverage and my fingertips here to help to get that to fold. Now for a lot of patients, they're like, okay, fine, Brian, thanks a lot, but how do I do that at home? So at home, literally all I have a patient do is use their own thumb like I used mine, and use the fingers back here on the hand as their leverage to basically help that motion right in here. Yes, just like that.
There.
Just like that, yes. So you can do it like that. I'm going to kind of show the camera how that looks so they can see it from this angle. But all I'm really doing, like I said, in this particular spot, you're kind of getting, if you have a lot of that force all the way across the wrist, you're getting all of them to move at the same time. If I'm doing a specific, like say right here at the base of your thumb, it's called the scaphoid. It's a very common area that if I can get stiff after a fall or favoring an elbow because of tennis elbow type of an injury, I'm just helping that to glide. Just like that. Now I can come all the way across the wrist if I want to be really specific. And you might get a pop in there. It's not necessarily the intention, but I'm just trying to make sure that they glide. Yes. And I'll do the same thing here into extension. I'll come with my thumb on this side, and I'll just use my fingers again to add that leverage with the hand. And my thumb just does that, basically just a little focused pressure so I can get anywhere along the wrist to go into extension.
Nice.
And it's once again, it's really basic. It's meant to be basic. It's meant to be fairly gentle, but it can be more aggressive depending on how much pressure you use and how much resistance you use.
Awesome. Well, that's nice because I think a lot of people have wrist issues either from overuse or from falls, and that's a real simple mobility thing just to improve mobility. And I think as you find, you improve the mobility, hopefully you improve that stiffness, you improve the pain or your function, and then you can start strengthening better.
Yeah, so I agree. I completely agree.
That's awesome. Well, happy wrists to everyone. Hope you guys have a great day and enjoy.